Good day once more. Welcome to episode 3 of the Unfiltered Teapodcast. Remember, the truth is everybody's cup of tea. Today, it's a pleasure to be back on the show once more because we have an amazing guest, the amiable Dr. Obiamaka Anya Chiebelu.
Yes.
I got that right now.
Yes.
Okay, Anya Chiebelu on the show. She's a consultant plastic surgeon. Not just plastic surgery, she's a consultant, burns, reconstructive, and aesthetic surgeon. Working currently in Abuja, board certified, and I'm going to be having loads and loads of questions for her today. So you're welcome on the show, Dr. Amaka.
Thank you so much. It's my pleasure to be here. So like you rightly said, I'm Dr. Obiamaka Anya Chiebelu. I'm a consultant plastic, reconstructive, and aesthetic surgeon.
Okay.
So the aesthetic surgery is just one branch of my qualification, and I practice here in Abuja, Nigeria, and I'm an expert in these fields: burns, reconstruction, and aesthetic surgery.
Okay. So I won't delve into the burns part. We'll go straight into the aesthetics part.
Which is the part that makes for interesting conversation.
Exactly. So, can you just share with our viewers and our followers what aesthetic surgery, what does it entail, what does it actually mean?
So, aesthetic surgery can also be described as plastic surgery. You can either say plastic surgery or aesthetic surgery. It's a surgery that is implemented to make you look better, to improve your form or your shape. It doesn't mean that anything is wrong functionally with that part of the body or that part of the anatomy. It only means you want to enhance, improve, and make more beautiful or more aesthetically pleasing. So that is what the field of aesthetic surgery entails, just to make better and improved you, so to speak.
Okay, so kind of like apprentice angels. So basically, if this was heaven, people will be in the department of building and construction of humans. Basically.
Well, yeah, that's an interesting perspective. I never quite thought of it that way. You could say that.
Okay, so let's speak to your background first.
Right.
Why did you pick an interest in that your field? Because I know there are gynecologists, endocrinologists, oncology. So why did you specialize in burns, reconstructive, and aesthetic surgery? Why did you specialize in that part?
So the reason off the bat, I actually knew immediately I was in medical school, even before residency and further training, that I wanted to do plastic surgery. My exposure to plastic surgery via television programs, via literature, through those exposure, I was able to identify that this is the part that would suit me more. And the reason I would say is because of it's extensive from the top of your head to your toes. It is very diverse and it is also very rewarding. When you're able to change the form of a person, it's immediately gratifying. You don't have to wait days or go through rehabilitation for you to get that instant satisfaction of the work you've done. Right there on the table, you're able to get that result. You're able to tweak things to get the result you want. So it is very satisfying, and then it is highly impactful. When you've done this surgery, it improves positive body image, boosts self-confidence, and even impacts positively on both the mental and the physical health. So it's just a lot of gratification, immediate gratification.
So in a nutshell, you chose this field for instant gratification.
Well, that is highly simplified, but you know.
So in Nigeria, it's on there's a surge. It's almost like a sudden surge for these aesthetic procedures, because prior to 2009, 8, 7, these things were not on the rampant. We just knew that, oh, okay, you are either physically endowed by birth, just by genes, or you don't have it. You understand? So and everything. While I agree with you, when you said it boosts self-confidence, you know, in mental health and everything. What's let's start with the side effects. What are the side effects of please, first of all, what is BBL? I know, but for our viewers out there, let them hear from a professional point. What does BBL mean?
Yeah, so that's a good place to start. BBL means Brazilian butt lift. It's Brazilian buttock lift. It's a procedure that is believed to originate more from Brazil. So the Brazilian buttock lift. It's not really that you actually lift the buttock. What the surgery entails is that you take away fat from unwanted places. For instance, you have a big belly, you don't want that big belly, you take away the fat. On the sides, where we call our love handle, from the back, that causes all those folds, all that fat is taken away. Now, when that fat is taken away, it can be put to good use because you've taken it from a place where you don't want it, and you want to put that fat in a place where you want it. And where do you want it? You want to accentuate the hips, the buttock. Then you transfer the fat that you have taken from those unwanted places, and then you transfer it to the buttock, and that now creates a beautiful contour and increases the projection of the buttock as well.
Okay, by projection you mean size?
Size, the shape, the outline.
Okay.
Yes, and then with that is what you call the BBL. Okay. So the BBL incorporates the removal of fat from an unwanted place and injection of the fat to where you want it. Okay. Yes, which is usually the buttock or the hip.
Okay. Now these fats, when you remove them, when you take them from that part of the body, are they still viable? Then when you introduce them into another part of the body, do they bind with other fatty cells there, or do they congeal? Do you understand?
Yes.
So I just want to know what is how is that? Can you shed some light on that?
Yes, it's actually quite simple. This process actually occurs within a few hours. So you take away the fat from that part of the body and you inject it safely into the part of the body where you want it to be. And the fat in that part of the body, there's already blood supply to that area. So it's going to take up blood supply in that area. But in that process, it goes through some changes. So the amount of fat cells you've put in is not 100% of them will survive. So they will have to gain vascularization in that area. So there are techniques that we as plastic surgeons, we incorporate into our surgeries to ensure that as much as possible survives. Yes, but it takes up blood supply and then it survives, but some of them would not survive, and in that period the size of the buttock shrinks, and then subsequently when it survives it goes back to the size immediately post-operatively. Yes. And then also there are cases where a good amount may not survive, but there are factors you can put in place to ensure that happens. And then these fat cells do start to act like the fats that was originally in that area. If you lose weight, you lose that fat. If you gain weight, it gets bigger. So it becomes like the physiological fat you already have in that area.
This fat, when you remove from other areas and introduce to these areas, now is it different from, you used to introduce silicone, or your silicone and old technology, or so? I'm just trying to.
Most of the time, when you have you have an option to use natural tissue from that same person, we prefer it. So no, the fat we harvest during a BBL is enough to create the hourglass shape that the client is looking for. So we don't have to do silicone and then do silicone implants as well as the fat graft. So we call the BBL fat graft, putting fat into the new place. So the fat alone is sufficient. But having said that, there are other places where we do silicone implants, such as the breast enhancement surgeries.
But aside maybe the breast, the buttocks, the 360 lipo, can you just tell us what 360 lipo means? Because I heard 360 lipo, 360 lipo. So you take fats from the arms, the stomach, everywhere, you know. So what does 360 lipo entail?
So 360 lipo, if you're standing in front of me, you have your tummy, you have your right side, your left side, and you have your back.
Yeah.
So going round makes it a complete revolution, which is 360.
Okay.
So that means we're going to liposuction your abdomen, your tummy, the right side, the left side, and then the entire back.
Okay.
So going round the patient's trunk
Okay.
makes it a complete 360.
Okay.
So there are people that would even tell you, oh, they're fine with their back, they're happy with their back,
Yeah.
but they have this big tummy and
Yeah.
just want you to do just liposuction of the tummy. Some don't even want you to transfer to their hips or to do the BBL. They feel, oh, I have a nice shape, but my tummy is huge since I've had a baby, I had twin pregnancy, and you know, so there are things we do for that, or just people who simply have a fuller tummy and then they want you to do the liposuction alone and they're satisfied with that. But 360 lipo, you do remove the fat all the way round the trunk of that client.
Okay. So also I know people do nose, the injections they give for eyes to make eyes firmer, you know, lips, are those safe? The Botox injections they give, are those safe? Those materials they inject into the body, the chemicals, are they safe? That's the question that I think our viewers want to.
Yeah, so injectables are another group of interventions to improve the features of a person.
Yeah.
For instance, when we start to grow old, there are so many changes that occur in our body, in our face.
Yeah.
Our skin loses its elasticity. It begins to sag. We have more of wrinkles, deepening of wrinkles and lines on the face. Even our fat deposit starts to shrink and deplete. Even the bone, the skeleton on your face starts to resolve and shrink a bit. So there are some changes that are associated with aging. You have hollowing under the eyes, you have deepening of the facial groups, laugh lines, deepening of the furrows on the forehead. So when you have things like that, there are things you do. And that is where it is important that you have someone who has been well trained in this field to evaluate, because there are so many components that need to be fixed. Because the Botox itself, actually what it does, it's a neuromodulator. So what it does is that it paralyzes the muscles of the face. So it makes them to stop moving the skin and creating those lines. So when it is paralyzed, you find that those lines and wrinkles are not as marked as before, but it has to be done safely because there are complications that can occur. So you have to be able to find out, is this the changes in this face, is it as a result of laxity of the skin? Is it as a result of loss of fat? Or is it as a result of active muscles? So if it is as a result of all these three components, just doing the Botox alone is not going to be enough. But usually a combination of Botox to reduce the strength of the muscle, putting fillers, using fillers. There are fillers to boost the volume, and then sometimes a facelift. When these three are done, you're able to pretty much reverse the look of that particular client. But like you said, it must be done safely. So yes, fillers are safe. There are lots of studies, they are safe, but like any other product out there, it must be used right and correctly. You must have the training and the required certification to be able to do that. And yes, there are some small risk of complications to any procedure that is to be done.
So if these things are going to be introduced maybe regularly to maintain that look, I don't think the human body, was it created to be constantly paralyzed? You understand? I believe there's a natural progression. And we've seen, I've watched some programs like Botched. There's this Botched that they show on DSTV. Do you understand? So I watch all those programs too. Do you understand? And I know that natural progression is almost like the law of diminishing returns. The older you get, do you understand? The changes show on your body, your hearing, your sight, your movement, all functions of the body depreciate, but you've been using them all your life. So, and we've seen stars, superstars that are taking so much of this injection and that now they are barely recognizable. So I want to, and this is becoming like I said earlier on, it's becoming a surge amongst Nigerian young ladies. Botox. It's not more before people hide to do it, but now it's and I feel a woman's confidence. Do you understand? It's her choice.
Yes.
It's a woman's body, it's her choice. I'm of the opinion that all these things in the long run might have lasting medical side effects that might not be known now. So I want you to, as honestly as possible, because you are not the manufacturer of these products. Do you understand? So as honestly as possible, and as humanely as possible within your parameters of your field, what are the side effects of all these procedures? Let's start with the Botox and the fillers, then we'll come down to the BBL.
In asking this question, you've raised very valid points and concerns. But at the end of the day, man has been given very high level of intelligence to conquer and improve his world.
True.
So
True.
that is how I think we should also approach the concept of plastic surgery.
Yeah.
Before, people used to die of diabetes, hypertension in their 50s and their 60s. Now there are advances in medication that have encouraged people who became hypertensive in their 30s, they live up to their 80s and 90s.
Yeah.
So that is also, now that there is now improved longevity all over the world.
Yeah.
Why do we have to, because of the aging process, we should all go with it because it's a natural process and we should all age? People are strong and healthy. There are people in their 70s and 80s playing golf, traveling all over the world. So why, if they feel young and energetic on the inside, why should how they feel on the inside not also be representative on the outside? So this is where plastic surgery comes in, to improve their look, to improve their enjoyment, people's enjoyment of their life. So with regards to the side effect, there is no procedure that does not have possible complication. People have choked drinking water, and we need water to live. We all take paracetamol every day. There are people who drink paracetamol and have a huge allergy, and they die from just paracetamol that thousands of people take.
In your profession, in your opinion, because there are lots of quacks out there still carrying out procedures in terms of Botox, fillers, and even BBL, maybe injecting silicones into unsuspecting victims. So, in your professional opinion, who should carry out these procedures? Because I recently watched on one of the Real Housewives episodes where I won't call names now. I don't give publicity to people on my show. So where one of the stars went for a procedure, and the person that was to carry out the procedure was a nurse. Do you understand? And she was proudly saying, "Oh, she has certification in the UK NHS." This. And I was wondering, are nurses supposed to be giving Botox injections? Are nurses supposed to be giving fillers? Are nurses supposed to be injecting silicones? Or are nurses supposed to be carrying out any surgical procedures at all in this field? So I want to know, is it that it's open for all?
Just to backtrack a bit, nobody should be injecting Botox at all.
Okay.
So the people, in my opinion, who are supposed to perform these procedures are medical doctors who have undergone further training after they have graduated from medical school. There are different aspects to aesthetic surgeries. There are surgeries that are not invasive, they are not highly invasive, and there are highly invasive surgeries. For the less invasive procedures, such as the injectables, I do believe that medical doctors, any medical doctor, any field who has gotten further training and certification may be able to, preferably dermatologists, people in dermatology and similar fields, they should be able to perform some of these surgeries. But for the more invasive surgeries, these are surgeries where that requires rigorous training in surgery, in anatomy. Anybody who has not undergone such training should not venture into it because the risks of complication increases tenfold.
So now, what do you think can be done to weed out the non-certified people or the quacks? Do you understand? Because it doesn't sit well with me when I see nurses, do you understand, venturing into all these are uncharted territories in Nigeria. This aesthetic surgery is just like I said, just a new sword, it's a new thing. So we need trained people to be there. We don't need people that have not gone through board certification. So how do we know who is certified, who is not certified? Then even when we know, what can be done by means of, let's say, from your board, government, and legislation, what do you think can be done?
Yeah, that's a beautiful question. If I take time to think about this question, I would readily suggest regulation. There has to be better regulatory processes to the establishment of these facilities. And the plastic surgery community, the National Association of Plastic Reconstructive and Aesthetic Surgery, are doing the best they can. They have brought themselves together, not funded by any government body, or funded just by the organization itself, to collate a list of all the plastic surgeons, board certified plastic surgeons in the country, and it's readily available. Anybody can view, can search for the surgeon they have in mind and see if that person's name is on the registry. So that is one amazing thing that is being done. Another thing is that the government will have to put some laws and legislation to curtail the flourishing of quacks that go, or uncertified people, unqualified people who go into this industry. So there has to be rules and perhaps even punitive measures to deter people from going to these fields that they are not qualified to do, and regulatory bodies that ensure rigorous screening of the approval processes to establishment of these practices. So I think these are some of the things the government could do to
because I was thinking, because before government enforces, there has to be law. So if what they are doing now is not breaking the law, do you understand? So I was thinking, is there nothing your council, your board can do in terms of legislation? Maybe draft a bill or propose a bill regulating this sector and forward it to the National Assembly, so that it becomes law that you have to have a minimum of this, to open shop anywhere within Nigeria. You get me?
Yes, so I do.
That way, the government
can then act.
Can now, because I don't think your body can go about closing shops. You guys don't have that
Not at all.
Power.
Our body is only
to regulate the professionals.
For the professionals.
Exactly.
To ensure the professionals are practicing well.
So it falls at the behest of the government. So, enforce that only people register with the body. But I think the body has to go an extra mile to maybe put together a bill. Do you understand? That regulates the sector and the practice of this profession and forward it to the National Assembly. So they can take it on the floor of the National Assembly, pass it into law. That now equips the police, do you understand, and other relevant agencies, Consumer and Consumer Protection Council, do you understand, NAFDAC, and all those other professionals within all the regulatory bodies within the government to now go out and shut down, because there's a law now backing it. But the law has to be framed, it has to be tutored, or let me say, it has to be made to suit, suited to fit the profession, and only you people know what should be looked out for, what constitutes a professional, what constitutes. The barest minimum. So I feel you push the onus still rests on you people
to some extent,
to propose a bill regulating the practice of cosmetic or aesthetic surgery. Because these same people that are giving Botox injection, they can't do bonds.
No, they cannot.
They can't do reconstructive surgery.
True.
But they can inject silicone into the body,
even a plastic surgeon doesn't inject silicone. Silicone is not supposed to be injected at all.
Yes, and they just do it on the butt cheeks. They say it's just small, you know. So and it's a disaster waiting to happen.
Yeah.
Then your website. I don't know if it's a website.
Yes.
That has a list. Probably you share it with us here, so we'll put it on all our social media platforms so that you know these are the amount of plastic surgeons we have in Nigeria. These are their names.
Yes.
So before you walk into any office, you can double check.
Yes.
Then also what to look out for, just in case you don't go to the website, you walk into an office.
Yes.
That's why maybe you should display. There should be a membership certificate.
Oh yes, we have our certification is as fellows of the West African College of Surgery.
Yes.
So there is a certification that shows and lists your area of specialty.
Now you people can go an extra mile to have that certification. That's the qualified one you're talking about. But as a body, do you understand? If there's something you can give to your members that comes with a barcode, but it can be, if you give it a certificate, it can be fake, it can be forged. Anybody can just forge it. Once you see the original, you can go and forge it and hang in your office. So something that comes with a barcode, that even when I walk into an office, I see it, I can scan.
Right. Okay. So like what these the medications we take.
Exactly. You know, those artesunates and all those things. So no original drugs. You understand? So you just have a barcode with the certificate you issue to your members.
Okay.
So because this is something that I personally would also want to take up.
Okay, it is an interesting perspective. I think it's more under your purview, and I don't have all the information to really make statements, but it's definitely something that one will have to go back and actually know if anybody is even in the process, or any of our organizations is in the process of already establishing this, and perhaps then take it from there.
Okay. So I want to find out who is eligible to undergo aesthetic surgery, because I don't want to believe that anybody can just walk up and you just tell the person, oh yeah, you have to meet some certain health conditions. You have to, because I know for appendicitis and other procedures, you have to have maybe aesthetic being some, maybe you should not have maybe diabetes or so, or they should have managed it to an extent before they can put you under and before you can go under the needle. So I want to find out who is eligible for. It's not just, oh, I have a small bump, I want a bigger bump, and they're there, and maybe the person is hypertensive or something, and you say, okay, come, you can do it. So I mean, who is eligible to undergo aesthetic surgery?
That's a very good question, and you're absolutely right in your thinking. We do have quite a rigorous process of screening before a patient is considered eligible to have plastic surgery, because plastic surgery is an elective procedure. It's a procedure of beauty. You're trying to go from a 6 to a 10. So nothing is wrong functionally. You're trying to improve appearance. So having said that, it is important, especially in this case, that it is a safe procedure. So we have some checks that we do as plastic surgeons. First of all, in the consultation, we have to know that you're doing the surgery for the right reasons. We have to be assured that you're in the right mental state and mentally capable of taking that decision that you want to improve on your body, on your body image. Then we also ensure that you have maintained a steady weight prior to the surgery, because fluctuating weights can affect the outcome of your surgery. And then another thing we do is that we ensure that the expectations are realistic. The client doesn't have unrealistic expectations. We do rigorous screening of clinical conditions, comorbidities, like you said, diabetes, hypertension. These have to be well controlled. It does not mean that someone who has diabetes cannot improve their look. In fact, some patients who do plastic surgery, like the tummy tuck, they have some of these illnesses actually reverse after their procedure. So, but we have to make sure that these conditions are under control. And if they are not under control, we will have you go to the specialist, have it controlled before you come back for surgery. Then also we do rigorous checks, the heart, the lungs, all the organ systems. If there are findings that show there are problems, or previously undiagnosed problems with the heart, we refer you to the specialist who would have to clear you for surgery. And if you're not cleared, we will let you know you're not eligible for surgery.
Okay.
And then no plastic surgeon will take on someone who's not eligible for surgery, because safety is our watchword. We want to be as safe as possible.
Nice. Okay, so in your in your course of your profession, which has spanned some decades now, what is the weirdest aesthetic procedure you've ever received from a client?
Okay. First, I have to ask. This is 18 and above, right?
18 and above, adult content only.
Okay. So the weirdest request I had was from a young male client. He wanted enhancement of his male genitalia.
Wait, just hold that thought. By male genitalia, you're referring to the penis?
Yes, I am referring to the penis.
Okay.
So he said in his words that he wants to be built and likened to a horse.
Okay.
And he wanted massive proportions in that area with regards length and girth.
Okay.
So that's one of the weirdest requests I've had.
So in my thought, I'm of the belief that for a man, is what you have is what you work with. There's nothing that can be done about it. But were you able to accomplish that? Were you able to fulfill his request? Or is there, but let me ask for my own personal information to enlighten myself. Is there something that can be done to improve on the length and the growth of the male penis?
Yes, there are surgical procedures that can be done to improve the length and also to increase the length and also increase the girth of the penis. Like I said, any procedure has its own complication rates.
Yeah.
So there are surgical procedures that can be done. For that particular client, he had unrealistic expectations.
Okay.
In plastic surgery, you have to be sure that you're not going to leave the patient worse off than he came with. You have to actually show improvement. In that case, the risk of surgery wasn't worth the anatomy he already had at the present
time. It was
time.
a cat that wanted to be a dinosaur.
He was a dinosaur that wanted to be a bigger dinosaur.
A bigger dinosaur. Okay.
But having said that, I in my judgment, it wasn't suitable for him to undergo that procedure. Yes, but there are things, there are surgical procedures that can be done to increase the length a bit, not incredibly much, but just to increase the length a bit as well as the girth a bit, surgically, and that doesn't include these lotions that are being sold that we know do not work.
Okay. So quickly, we're rounding up now. What advice would you give to someone that wants to do aesthetic procedure, whether for the nose, for the chin, BBL, Botox? Would you tell the person, go and think about it, go home and think about it? Or would you tell the person, oh, come on, let's do this?
Well, my advice and this is what I would always ask my clients, I always want to know why you want to do the procedure, and I am looking out for a certain kind of response. I'm looking out for a response that sounds like it is affecting my mental state, I'm not confident about this part of my body, and it even affects my physical well-being, it impacts my daily life, my self-esteem, I don't have a positive body image, and I believe that if I have this procedure, it's going to improve my life in all these areas. So I want to be sure you're doing this procedure for the right reasons for yourself, and you've thought about it. And even after the first interaction, would it give you an information packet for you to read all about it, commonly asked questions, the procedure from prior to surgery, the surgery procedure itself, details about it, the post-operative expectations, and then you're armed with information so that you can actually take, because when you have information, you can take an informed decision. So these are some of the things. Then there are some other things one also looks out for. So in essence, I would tell someone who wants to do plastic surgery to understand the reasons why they are doing the plastic surgery and be sure they're doing it for the right reasons, to have a realistic expectation of what the outcome will be, and that helps a lot. Sometimes you find someone who has what we call a V-shaped pelvis. Actually no buttock, and then they tell you, they show you their wish picture, and it's like 2 times perhaps what Nicki Minaj has. It's an unrealistic expectation. So having a realistic expectation is important. Then I'll also advise them to do their research, find out the facility, the surgeon in the facility, maybe see some of their work as well, and be sure that this is the plastic surgeon that is for you. Because plastic surgery is an art form, in as much as we marry the surgical principles that we have trained for many years to have good knowledge of, with our own creativity. It's burning art. So there are some surgeons who are particularly good at giving the biggest, most beautiful, luscious buttocks. Then there are some who will give the tiniest waistline and a natural but curvaceous body. So you have to know what you want and align yourself with the surgeon that would give you that kind of outcome. So these are some of the things I will advise the clients, and then also go to the website, ensure that you're going to a board certified plastic surgeon. Yes, and then lastly, when you've done all that and you have all the right answers, I would say go for it, because it does impact life quite positively.
So basically, viewers out there, you've heard from the mouth of a seasoned professional, Dr. Obiamaka. Thank you very much.
Thank you so much.
So you've seen now that the reasons for venturing into body aesthetics is not for commercial purposes. It's not for, I want the richest man, I want to buy the flashiest car. That's not why you do it. It's for your own mental health, for your self-confidence, for your everyday life, and it's to make you a better person. But for whatever reasons you decide to do it, your cup, your tea. Thank you once again for being on the show. You've laid to rest. Even I myself have been informed of some of my previous misconceptions, and you've laid to rest a lot of questions our viewers had out there. So as the time as we progress, I would probably maybe ask you to come back on the show, so you could maybe clear some questions. But just before she goes, she's offering a 25% discount on all procedures that's going to be done through your Unfiltered Teapodcast. So all you have to do, use the promo code Unfiltered, follow her on all her Instagram and social media handles, and also when you meet her, let her know that use the promo code, like I said, Unfiltered, and she'll be offering a 25% discount on all procedures, all aesthetic procedures that will be carried out by her in Abuja or wherever you are in Nigeria. Maybe you probably can fly her down, and maybe she has a facility that is up to her standard. She can meet you anywhere, but just remember, 25% discount with the promo code Unfiltered. Obiamaka, do you have anything to say to that?
Well, your followers are lucky that you negotiated such a fine discount for them. So yes, we are going to be offering the fans and followers of this podcast a 25% discount that is going to be ongoing for a period of 6 months, thanks to Mr. Oseni here.
So thank you very much for coming once more on the program.
So much.
So you've heard, she has spoken now on Vanished Truth at the Unfiltered Teapodcast. Until next time, stay with us. Thank you.